Hey, it's Dr. Schmidt. So I'm going to teach you this case study. I'm going to do more case studies on my channel. And what I realized is that a lot of people on social media, when they talk about healthcare, they talk about their own personal experiences, number one. Or number two, they go over some research. Or number three, they'll have like a 5-step plan for you to do something. But this is different because it's a person that actually got better over the course of 6 months, or in future case studies, it might be over the course of a couple of years. And what they did, and then while you're watching this, you can think, what's in it for me? What can I learn from this? Because when I had black mold, I had symptoms around here in my heart, and I went through some old notes. And the best thing that helped me out was to see a bunch of people. They all had different types of heart pain, and they went on maybe 10 to 20 different types of supplements over all of the different cases, and I picked 5 of the best supplements, and then I felt better. So now I got to give you a disclaimer. I'm not your doctor unless you have the paperwork to prove it. So please don't ask me to answer any questions about how many pills you should take or what pills you should take. You got to call the office, and I'll take a whole detailed history. We have a 10-page survey, and then I can start like figuring out like what is this puzzle that you have with your health. And we can start with step 1 and go from there. YouTube comment sections and comment boxes are not an appropriate place really for a doctor-patient relationship. Now, I don't diagnose or treat disease. There are 1 million medical doctors that will. My job is to find out where you're nutritionally deficient and what toxins you have that need to get pulled out. And then we increase your health and wellness. This is health care, not sick care. And you'll see that with this case right here, the difference between the two. I do health care. So this person here, he's 61 years old. His first consultation with me was April of this year, 2019. He's a retired disabled rancher farmer in Texas. He's had a bunch of other jobs. And then I emailed, can I use your video? Can I use you as for a video tomorrow? I won't say your names, but I'll go into detail about the supplements, lab test, symptoms, and history. And the reply was yes. So I'm talking to him and his wife. Okay, so he's 6'7". He used to weigh up to 280 pounds. And just imagine a Texas rancher, a big guy. And but in January of 2013, he had a stroke. And then again in January 2014, he had a stroke. And his weight has been going down ever since. So he got down to 160 pounds at 6'7". So in January of 2013, after the stroke, they found he has MRSA infection in his mitral and aortic valves. They replaced both valves. And then he got septicemia, and he almost died from that, so they put him on antibiotics. It happened again in January of 2014. The mitral valve was replaced again due to infection, and then he got septicemia. So he's lucky to be alive. And during this time, he got excessive vomiting and dehydration, and no known cause for the excessive vomiting. So he gets headaches over the left ear, acid reflux and heartburn, of course, nausea. He can't walk far. He gets a hacking cough and dizziness, and it comes on suddenly when he walks. He's been decreasing his carbs for 6 weeks prior to our first consultation, which is great. Him and his wife on my YouTube channel, they started changing the diet. And he's diabetic, so his sugars were spiking up to 326 with no insulin and eating dessert. So here's a couple labs I pulled. Number 1, his creatinine is 2.0, and that's a measurement of his kidneys, and it should be less than 1.27. And his GFR, its filtration rate of the kidneys, it should be above 60. His is 34. So his kidneys are in bad shape. And his A1C is 7.2. That's the long-term measurement of diabetes. It should be like 5.0. 5.5 is acceptable, but he's at 7.2, and he's on insulin. Okay, so top 5 subjective symptoms. He's daily dizzy. Every day he's dizzy for over a year. He's vomiting daily. He needs to go to the hospital for hydration. How horrible of a life is that he's vomiting daily? That's horrible. Panting, breathing, easily fatigued, and muscle wasting. He's basically dying. So I created a survey called Follow the Physiology Survey, and he filled it out. And this is what I pulled from it: yeast, toxicity, constipation, diarrhea, gallbladder, pituitary, craving sugar, fatigues, 9 out of 10. So with this survey, I can find out what organs are most negatively affected, what's causing all this, and do you have the mechanism of chronic disease. And what they said was everything is worse in the last year. This all started in 2013 and then again in 2014. And here it is, between 2018 and 2019, everything is worse and he should be better, but he's not. Here's the drugs he's on: warfarin, a blood thinner; augmentin is an antibiotic because you don't want another infection in the heart; digoxin for atrial fibrillation, any kind of weird beats of the heart. His blood pressure is low. It's 100/40. That is way too low. He's on cyclobenzaprine, which is a muscle relaxant, to try to affect the constant nausea. He's on baking soda for his stomach to stop the nausea, and then phenergram antiemetic to stop the vomiting. So he's on 3 things to stop this constant vomiting. He's on the insulin called Lantus, and he's taking a shot once a month called Procrit. And they test his blood to see if his red blood cells are low. If they are, they gave him the shot of Procrit. So he's on 1, 2, 3, 4, 5, 6, 7, 8 medications, and he's getting worse. I see this all the time. Here's their goals: improve health and life, get off meds, educate on supplements. When I say they, I mean him, and his wife is helping. Okay, where do we start? Low carb diet. That's where you start. And he had started that 6 weeks before calling me. A lot of people that call me, they've seen my YouTube videos and they already are doing low carb, and some of them have already gotten into ketosis, and some of them have already dropped 20 pounds before they call me. So that's where you start with the low carb diet. It is the natural diet of the human body. All right, now these are the supplements that I recommended. Some of them I recommended on day 1, some I recommended later as time went on. But Cataplex B, 20 a day for lactic acidosis as defined in 1932. You got to check out my videos on lactic acidosis. It is the mechanism of chronic disease. Now, if you go to the hospital now and you say, look, I saw this chiropractor in Michigan and he's talking about lactic acidosis and I think I have it, they will laugh their heads off at you for being ignorant. But the truth is, the definition of lactic acidosis is different now than what it was in 1932. So this supplement Cataplex B was made in 1934 to fulfill that definition back then. And it works wonderfully. All right, so don't go telling medical doctors that you got lactic acidosis or that you took Cataplex B and it fixed your lactic acidosis and you felt so much better, even though it's true. Remember, it's just 2 different definitions. One from 85 years ago and then one from now, completely different. Okay, so the Diaplex supplement is a multivitamin for blood sugar control, Vasculin for people with low blood pressure and low energy, Drenamin to feed the adrenals. So if the adrenals are hypo-functioning, it'll help them up. And if the adrenals are hyper-functioning, it'll help them calm down. Those 4 are from Standard Process, one of my favorite supplement companies. The next one is Cater. It stands for kidney diuretic, KDIR. And that's from Systemic Formulas. The next 2 are also from Standard Process. Renifood, which is food for your kidneys, whereas Cater is like flushing. Renifood is feeding the kidneys. And then Pituitrophin. And Pituitrophin feeds the pituitary, which is right in the center of your brain. And when the pituitary is inflamed and not working very well, it shows you by causing pain over the left temporal area. Above the left ear, somewhere in here, that's where the pituitary is screaming at you, hey, I need help. So you'll see what happens when he starts taking it. But I don't recommend it on the first visit. I actually recommend it on the second visit because as I gathered more information, it's like, oh, duh, like we need to do this. All right, let's go on. So here we have results 1 month later. So we started off with the initial Standard Process supplements, and he has some improvements: less panting, breathing. Perfect. He's got more oxygen in his blood. That's what Cataplex B does. That's what Otto Warburg got his Nobel Prize for in 1931, was on B vitamins, then called respiratory enzymes and how they make people breathe better. He is breathing better from technology and discoveries from the mid and late 1920s. Blood sugars, he has less days over 200. His diabetes is going away. He went to the doctor again for his monthly check on his red blood cells, and he did not need to have the Procrit shot. And that's primarily because a lot of those initial supplements have liver in them and other nutrients that feed the body and feed the blood. Okay, we have a new blood test, 2 new blood tests. The BUN is 42. That's a measurement of kidney function, and it should be less than 27. And his creatinine was 2.0. Now it's 2.1. So it went up a little bit. Okay, and it should be less than 1.2. All right, now he's still underweight by a lot. He's down 13 pounds since April 3rd, and now here it is, May of 2019, and he's losing muscles. I already mentioned that. And once he had to go to the ER due to vomiting. Okay, so his vomiting is still so bad that he actually had to go to the ER for it. And he had 3 bags of fluid for hydration. This is the point where I added the pituitrophin to fix this and all the digestive symptoms. And here we have results 2 months later from the first visit, 2 months later. And now he's only had 2 episodes of vomiting the whole month since starting pituitrophin. It's like a miracle pill for a lot of people. Okay, so only 2 episodes of vomiting and nausea, only 2 episodes of dizziness. He's 90% better. Those were his 2 main concerns, was daily vomiting, daily dizziness. He's 90% better with those 2. He gets fatigued walking short distances with shortness of breath and panting. We already know that, but it's getting better. And he's still trying to increase protein in his diet. So we got to fix up his organs here so he can digest meat better. Okay, I'm going to move down a little bit. Constipation and diarrhea completely resolved. And he still has not needed the Procrit shot. So his anemia is still gone. He's getting lower and lower blood sugars. And he's had no headaches since the last visit. No pain up here. So this is a miracle at 2 months. Here's 4 months. Okay, one morning he couldn't breathe. So he got a breathing treatment with albuterol. He had fluid in his lungs. His oxygen levels were good. That's a great sign there. But now I'm gonna tell you what they said, what the MD said. Low testosterone levels can cause weakness, which prevents the rib cage to expand. It can't expand with low testosterone. He had 1 shot of testosterone so far, and he's a little bit better. Okay, that's hard for me to buy into. He can't breathe because of other reasons. And I've seen this before where in the medical philosophy, it's like, okay, your testosterone is low, we'll give you a shot to raise it up. And usually the testosterone is like synthetic and it's not very good. And the results just aren't there. Okay, so whatever. He can do the shots if he wants, but that's not the solution. Okay, moving on. He's only had 2 episodes of lightheaded, but not dizzy. Okay, that's awesome. 2 episodes of nausea, but no vomiting. So he's much better at month 4. Now his weight is 192. They gave him a 30 days of steroids to try to dry up his lungs, which is okay that he's doing that, right? But you know, steroids always cause problems later. They don't solve anything. They suppress the immune system temporarily. And then what? So, but you'll see later that what I did here was I gave him a supplement called Resco, and that helped his lungs out tremendously, and you'll see that. At night when laying down, he needs to use oxygen, so he's got an oxygen mask. Okay, remember that. Tater dropped his blood sugar 50 points. That's the kidney supplement. Now initially, he didn't buy it because we didn't have it in our stock. Once he got it delivered to him, he started taking it. It helped his blood sugar tremendously. His kidneys are getting better. Here's results 6 months later. There's the Resco, did really well. And he's not wearing the oxygen at night anymore. And he's up 2 pounds. He was at 192, now he's at 194. That's awesome. His BUN, his BUN, is 26. Now, it was 42, and the normal range is 8 to 27. His BUN is now normal. And you know what the MD said to him? The kidney specialist said, your kidneys are now stabilized. Well, stabilized means that your BUN was 42 and now it's 42, right? It didn't go up to 100, right? She didn't say they were better. She did say, I'll see you in a year. And when they told me this on the phone, I was like, wait a minute, what were the numbers again? It's like, oh my gosh, your kidneys are normal according to the BUN. And his creatinine, which was 2.1, remember it went up a little bit from 2.0 to 2.1. Now it's 1.86 and it's dropping. We got to get it down below 1.27. The medical clinics never see people get better with their kidneys. The kidneys always get worse. The only way you can get them better is with diet and supplements. Okay, now continuing on with this. No vomiting. And only 2 episodes of lightheaded, dizziness, nausea, all gone. Breathing is not panting. Respirations were 38 to 40 cycles per minute. Normal is 12 to 20. Okay, but now his respirations are normal now that he took Resco. His highest blood sugar was 250 because the pharmacy ran out of insulin for 3 days and he didn't have insulin, but his lowest blood sugar was 67. He is reversing his type 2 diabetes. Now before, if he had no insulin and ate maybe some dessert, it would have been over 300. Okay, he still has that muscle wasting look, but he eats white bread daily, right? So when people have the nausea and the vomiting and all that horrible stuff, they tend to eat softer foods, white rice, white bread, that kind of stuff. And they tend to stay away from vegetables and meat because they're harder to digest. But he's getting better. So it's like, okay, now let's start slowly and do some shredded chicken, little bits, just a little bit, and some tuna. And if you're going to eat beef, it's got to be ground beef, and just do a little bit here and then add more. And it may take 2 or 3 years before he's eating a pound and a half of meat for lunch like I do. All right, the last supplement that I added at the last phone call, which was just recently, I added this product called Tutka Plus, and it helps recover from a stroke. And I have all this research on all the other things that Tutka does, and it's a derivative of bile from the gallbladder. But this is like straight up legit research going back, a couple decades. But it has cardiovascular benefits, benefits for diabetes, diet and digestive tract, stomach, kidney. That's all him. And then also thyroid and liver and brain. That's the repair from a stroke. And then nervous system and the blood-brain barrier. So Tutka Plus does a lot. Now you can buy Tutka Plus from me, and I'm putting the code below. You can buy it from Cellcore Biosciences using my code. And you can also buy Cater from me. I'm putting that link below. And in the future, you'll be able to buy Standard Process directly from me. So I'm looking forward to that. Now, when you buy supplements from me, remember, I'm not your doctor unless you have the paperwork to prove it. And that means we're on the phone, we're working on a program together. And maybe you have like already 50 bottles of different supplements at your house. And now you're going to add Tutka Plus, or now you're going to add KDIR. Well, that's fine. If you ever get confused and you don't know what your dosage should be, and you don't know what to do next, call the office, become a patient of myself or any of my other practitioners, and we can help you sort out that puzzle that is your health. That's our job. We take a history, we have you do the survey, we look at lab tests, and we figure out with our knowledge on nutrition and supplements and herbs and glandulars, etc., etc. I've been at this 22 years. I help you figure out these complicated type cases, right? Like what I just went over with you. And for me, this isn't complicated. This is standard, this is easy, and we're getting results. For most doctors, they can't do this because they don't have the tools that I have, that I've chosen, like the supplements, for example, like even the alternative holistic medical doctors that I've learned so much from related to ketosis, etc. They're not into supplements. And it's a huge missing factor in all of healthcare. All right, so I'm done with my little soapbox on that. But so if you like this information, please give me a thumbs up, share, and subscribe. And please share, because YouTube is doing a great job of clamping down on my channel. And the era of abundance with social media is totally over. And I'm working on a system of education for you. I've mentioned this before. I'm done with part 1, which I've written a 42-page document. That's sort of the basis of all the blogs, the e-learning courses that I'm going to put together, e-books, videos. I have the foundation of that. And then from here, we're going to grow. We're going to take different subjects and grow them into more detail, so you have more and more understanding of different subjects on how to actually improve your health using diet and supplements. And as your body gets better, symptoms go away, you feel better, and life is good. So give me a thumbs up, share, subscribe. See you at the next video.